now? Okay. All right, I'll start this again. I don't know what happened there for a moment, but if it goes out, just let me know again. All right, I'll start over. So, this is our quarterly assisted living update. We started these back in May so that folks could get updated once a quarter, 4 times a year on what is happening in assisted living, at least from the perspective of surveys and complaint investigations here at the department, and as well as if there were any licensing updates. And that way we can just have some regular check-ins with providers. My name is Daphne Pons. I am the Executive Operations Manager of the Assisted Living and Home Care Program, and also manager of our engineering department. And I'll have joining me today Matt Heffron and Bob Daler. I will let them introduce themselves, and we'll just be kind of ping-ponging back and forth during the presentation to give you some of the updates of things that have happened over the past quarter. Our first assisted living quarterly update happened in May, and so we'll give you some perspective and updates on what's happened since then. Let's go forward, move in the slides, Gia. Now this, I think I don't have the most updated picture of WebEx because WebEx has been updated since then, but participants during the WebEx will be muted. If you have a question, you can certainly put that in the chat. We will try to answer as many questions as we can during the presentation, and at the end of the presentation, we will have some time to answer questions. And so please just write your message in the chat and send that to the group, and we'll try to answer what we can. And if we can't answer a question during the presentation, we will try our best to, we always save the responses, and they can go back and see if we are seeing a pattern in questions and if we need to put out some communication about that. All right, next slide, please. All right, so for the agenda today, we wanted to give you a brief overview of what happened during the 2024 legislative session regarding assisted living, our complaint investigation trends, assisted living survey updates, and then some of our engineering updates. And so that will be what we'll go through for the next hour or so. Next slide. All right, so I'll cover with you the legislative debrief for 2024. What I'm covering is really limited to the impact of any legislative changes to the Health Regulation Division here at MDH, and specifically dealing with the assisted living license. Also talking a little bit about 144A with home care, because there are a couple of things to clean up that were cleaned up this legislative session. It just helps clarify some things for assisted living. And so there were some other things passed during the legislature, like regarding insurance or some other rights, etc., that implicate assisted living, but don't have anything to do with the license itself. And so I really am just going to be sticking to the things that deal with licensure today. And these presentation slides will be made available. We just didn't have them pre-posted for today, but they will be available on our website. And I think Gia here is posted where it will be found later. Okay, next slide. This was a very busy and fast-paced legislative session. There were over 11,000 bills that were introduced between the House and the Senate. I don't know if you're familiar with fiscal notes, but we had 35 fiscal notes this year compared to last year. We had 15. It's a very involved process where basically if someone's bringing forth a law and they want to see how to operationalize that law with the department, they'll ask for the department to help participate in a fiscal note, see how much will it cost to make that law actually happen. And so we had 35 of those this year. Amongst all the licensing programs here in HRD. And most of what occurred this year with assisted living that impacted assisted living in the Health Regulation Division was in this large omnibus bill. Now, each bill goes through a series of committees, and once they get to the end of the legislative session, I'm learning a lot this legislative session about how things get into an omnibus bill. But basically, it makes it so that once it's been vetted in all its various committees, that many hundreds of laws could potentially go into one big omnibus bill for the House and the Senate to vote on, rather than voting on each and every individual law. In this case, there was a tax bill and 8 additional bills that made out this large. It's where most of the laws that I'm going to talk about are found and passed in House File 5247. And so there were a lot of I think were unusual in some cases, such as this mega omnibus bill. Also, a large number of bills were introduced this legislative session that impacted assisted living. And so I'm going to cover some of those. We can go to the next slide. Now, there were several pieces of legislation that were effective as of this year, 2024, and I'll review those. Most of them were smaller changes, things that don't really change the survey process too much or have an immediate impact, or I should say a large impact as far as changes that you need to make to your survey process. But it's still things for you to be aware of and know about. And I'll go over any of the changes. All the things that you see here, I'm going to talk about each one. And all of these are already effective and are current law. So I'll go over each one of these that are listed on this slide. The next slide. So assisted living correction orders. Effective as of August 1st, AL providers must make correction orders available when requested. And who must you make correction orders available to? Well, it's anyone that would come to your facility and request them. Mainly going to be the public, resident family members, the residents. The facility has to provide a copy of the facility's correction orders, as well as the facility's most recent plan of correction to any individual who requests it within 30 days after the request. And it does say in a format determined by the facility, except that really you need to be able to make some sort of reasonable accommodation, such as, well, we only keep our plans of correction in the computer. Well, according to this, it would say paper copy would be a reasonable accommodation for the facility to be able to make upon request if the person does say, I'd like a paper copy. Originally, when this legislation came forward, it was that all correction orders and plans of correction would be posted in the facility. And then in the final version, it's come out now to it is just making them available. This is effective law as of August 1st. I know people have asked about when we would be surveying to this. And I'll talk about kind of our survey timeline soon. But I would say that largely this will be with the next survey cycle, as I know some people have not received. There's a handful of assisted livings that have not received their first survey yet, or may still be working on correction orders from recent survey. And so really, even though this is effective law now, I would be looking for the department to really be surveying to this starting in the fall, and making sure. Most often I would see this perhaps coming to light if it was a complaint made to the department, but it is something that we can check on survey to make sure that you have a process in place for folks who want to request correction orders and plans of correction to be able to receive those. Next slide. So the food code, minimum requirement modification. So there were several changes that were made to the Minnesota food code, not in the food code itself, but related to the food code in 144G. The new language affects facilities, assisted living facilities that had 10 or fewer residents. This actually came out of a work group that we had 30 different stakeholder types last year working from March to October with the Assisted Living Small Provider Work Group, where those stakeholders came together and talked about, which included providers and provider associations, and talked about what did we really need to see for folks that were in 10 or less resident settings, where really the Minnesota Food Code just was overly burdensome in some ways and just didn't apply to some of the small residential houses that we were seeing. And here's where the changes that came in, and this was effective July 1st, that the facility could share a certified protection food manager with one other facility. Kick plates are allowed, but they can't be removable or able to be rotated. The integral drain boards, utensil racks, tables to hold soiled and clean items are not required. A dedicated hand washing sink is not required. So if you had a double basin sink, you would be able to designate one side of that sink to be able to be your hand washing sink. Existing floor, wall, and ceiling finishes allowed if kept clean and in good condition. So if you've got the popcorn ceiling and you're in a 10 or less facility, as long as you're keeping it clean and in good condition, that popcorn ceiling is going to be okay. Shatter resistant light bulbs are not required, as well as self-closing doors not required for a toilet room. So before, all of these pieces would have been required in those small residential homes. And now there's an exception in the food code, I should say in 144G, that says it's okay to have this, even though these items, even though it is not allowed generally under the Minnesota Food Code. Next slide. Provisional license closure. This was just some clarification that was put in the statute that if you're a provisional licensee, there wasn't any timeline put in the statute regarding if you were denied your provisional license and you went for a request for reconsideration. There really was no timeline for the closure process. And so now it is in statute that you have to submit your draft closure plan. If it's upheld, that your denial is upheld after reconsideration, that the draft closure plan must be submitted within 10 calendar days, and then a final closure plan within 30 days of receipt of the reconsideration decision. You have to have that final plan to the department. And so that was just to help give some clarification in the statute about when that item would be due. Next slide. Definition of licensed health professional. So there were a lot of questions about what does this term, other licensed health professional, mean? Because there are several places in 144G where it will say an RN or other licensed health professional. Now we know that a licensed practical nurse is another licensed health professional, but where most of the references to other licensed health professional are in 144G, it's often cited in delegation to an unlicensed personnel. And so under the Minnesota Nurse Practice Act, an LPN cannot delegate to ULPs. Only an RN or another licensed health professional can do so under their own licensure within their own. And so this helped to clarify that when there were these 144G says licensed health professional, who it means is not an RN or not another RN or an LPN, but someone who's able to provide assisted living services within their scope of practice. And what we're thinking about is like your physical therapist, your occupational therapist, speech therapist, someone that's able to delegate cares to an unlicensed personnel within the scope of their practice. And so this just helps keep it with the original intent of legislation to keep that other licensed health professional definition to those that can delegate within their own scope. Next slide. We have staff orientation requirement. This was effective July 1st. And so this is hopefully going to be very helpful to many assisted living providers particularly those that may have several sites, several locations. You no longer have to repeat the orientation requirements in 144G.63 if the staff person transfers from one ALF to another ALF operated by the same licensee or the licensees affiliated with the same corporate organization. So this allows you to, those assisted living bill of rights, how to make a MARC report, how to report suspected maltreatment, some of those pieces that are the exact same. Those would be, and they're not site specific. Those will be portable from facility to facility if the ALF that the person's transferring to is operated by the same licensee or the same corporate organization. And so hopefully that will help save a lot of time and training and be a good fiscal change for folks and not needing to do so much repeat orientation. Now, anything that is site specific, so your evacuation plans, the information related specifically to your residents, anything about your facility that makes it different, that person will still need to be trained on. But they won't have to repeat these orientation requirements. They'll just need to bring with them proof that that orientation was conducted at the prior facility and be able to put that into their employment record. Now, if they are transferring from an ALF to an ALF-DC, the staff person will need to meet all the additional training requirements under 144G.83. So you will have to do all of that training if they're going from an ALF to ALF-DC. I do see some questions in the chat, and when I get to the end of this section, I'll go back and answer those questions. Next slide. Licensed Assisted Living Director licensure changes. These were effective July 1st, where that, and this is under 144A.20, where and person that's applying for an LALD license must apply within 30 days of hire and not 6 months. And that's what it had been previously, is that they could be employed at an assisted living facility for 6 months prior to applying for their LALD license. Now it's only 30 days. There are several changes to some of the qualifications and training. It says it must satisfactorily meet the requirements of the Board of Long-Term Care Services and Supports, may not be in training or scheduled for training when obtaining licensure. And so if you plan to be an LALD or have an LALD in the situation of where they have not quite met all of their training or training requirements, you want to look at 144A.20 subdivision 4 to see what those changes are. But this will require folks to have more of the qualifications in place before actually being hired. And not before actually being able to obtain their license. There's quite a few changes where they'll need to be able to meet certain standards before they can receive their license, as opposed to previous 3 years. Next slide. Now, this is a clarification that's actually in 144A, but we felt this necessary because there seemed to be, this was proposed by the department, there seemed to be a lot of misunderstanding between home care and assisted living as we would go out on survey to various home care agencies and still find that they were providing sleeping accommodations. And when I say the word sleeping accommodation, I want to think about landlord. Are you, as the provider, being the person's landlord and providing their services? So in the definition of assisted living itself, it clearly states that if you're providing sleeping accommodations and the services, that you are in assisted living unless you meet one of the exceptions under 144G. And so largely that was interpreted as, well, if it's sleeping accommodations and services, it's assisted living. You're no longer home care. But because of confusion and lack of clarification, it seemed amongst so many providers, it seemed like it would be a good idea to also state this in 144A and just say that a home care licensee must not provide sleeping accommodations as a provision of home care services. And so a home care licensee in the state of Minnesota as of July 1st really effective as of August 1st, 2021 with a new assisted licensing law, but this clarification went into effect July 1st of this year, that you cannot be a landlord if you have a comprehensive or basic home care license and are providing home care services, because really the services and being the landlord, that's assisted living. And go forward to the next slide. And then there were just some more deletions. As we're going through 144A, there were still several references to housing with services. Housing with services as of August 1st, 2021, with assisted living coming into effect, is no more. And so we continue to find references to that in 144A. So deletions of references to housing with services or housing contract terminations. We were able to do some more of that cleanup and get that passed. Just to make 144A more accurate. All right, go forward. One more slide. Okay, let me back up just so I don't get too far along to some of these questions. And Jude, you can back up one slide. We can just go to where I had that. There we go. Does the posting of the most recent survey mean full survey, or does it mean complaint surveys? Good question. So in my mind, I would have to make sure and go back and look at the exact wording of the statutory language. But if it says assisted living survey, it does mean the survey itself. Complaint investigation does have its own distinction under the law, and so that could be different. I would honestly want to go back and double check that. It would include the survey results of the survey and your correction orders, as well as a copy of what your plan of correction is to address those correction orders. So if it says survey, it really does mean your every 2-year survey. If it says complaint investigation, because there's a distinction in 144G, then it would be regarding your investigation. So I do not believe that distinction is there, but I would need to double check that just to be sure. If your survey was 2 years ago and the law only went into effect now, is this for new surveys going forward to make the correction plan available? So here's what I would say to that. Are we surveying to that at this moment? No, I would say as we start the next survey cycle, we will begin surveying to that. And I'll talk about that in a moment when the next survey cycle will be. I would say if you have a person come up and ask you for a copy of your correction orders from your last survey, it is effective law now. And that you would be obligated to give them a copy of your last survey correction orders and plan of correction. So it is effective law. It's possible that they could make a complaint regarding not being able to get a copy of those correction orders and plan of correction. Let's see, can physician-assisted owners of assisted living considered licensed health professional? I would say a physician's assistant is another licensed health professional. Oh, and Matt already has answered that. They would still act within their scope of practice delegated by the board. Could 144G.63, which I believe it was in reference to the portability of, I want to say that was in reference to portability of the staff training, apply to home care as well? It does not. It's in two separate laws. So 144G only applies to your assisted living license. And so they do not cross over and apply. It would have to be written into 144A for that to apply. And I see still 55 years apply or plus apply for new assisted living facility. Anything or any age restriction, assisted living licensure is 18 years or older. That's with your license. Anything that deals with age restriction regarding 55 and older or under, that really is a DHS reimbursement issue that's not affiliated with your license itself as far as what MDH has authority over. And so any questions that you would have about your ability to apply for an assisted living license and how that may impact reimbursement you need to go to DHS with those questions, because you can receive an assisted living license and house and provide services for folks 18 years and over under your assisted living license. But there may be implications based on age for your reimbursement, and that's DHS. In regards to someone with an ALDIR license in the community, does this affect the LALD license timeline changes in training? There were quite a few changes to the qualifications and requirements for LALDs. I would really highly suggest that you contact the Belts Board for interpretation of what the changes are and what the requirements would be. They are also currently, Belts is currently in the rulemaking process as well. So there are going to be some changes coming up from the rules related to LALDs. And so I really would encourage you for interpretations and knowledge of your requirements to reach out to the Belts. And just want to clarify about sleeping accommodations. Can an owner also work in the AL as a caregiver, can or cannot have sleeping accommodations? Oh, so we have an owner. So we have not, when you talk about sleeping accommodations, really we are only talking about residents living at the facility. We have not, now we've certainly said that there could be a sleeping staff member when you have an awake staff member, if you needed a backup for say a 2-person assist, that you could have a second staff member sleeping while the other is awake. But as far as somebody in a residential capacity living full-time at the facility, really that person needs to be an assisted living resident. Only assisted living residents are able to actually live at the assisted living facility. And so staff living at the facility isn't authorized under 144G. And my understanding is that the requirement for the correction orders and plan of correction would be the most recent survey. And does a change of not being housing with services change the requirement for Narcan? There's no changes regarding, I believe you're referring to a statute that passed a year ago related to a requirement under housing supports. I believe that certain facilities have 2 doses of Narcan on hand. The housing with services doesn't affect any requirements that I'm aware of. All right, I'm going to move forward. I think I got since we're about at 1:30, I got a truck on here. So new legislation that's effective as of 2025, 2026. Gio, we can go to the next slide. We've got license portability. So this will impact licensees with 5 or fewer residents, that they may operate under the licensee's current license if the facility is relocated with NDH approval. So for facilities that are 5 or fewer, if you want to relocate, if you meet certain qualifications, as of March 15, 2025, you would be able to maintain your same license and then be able to move one time within a 3-year period to another physical building. Now, right now, under 144G, assisted living license is tied to the building, to the physical location where the facility is. This particular statute, 144G.195, will allow smaller residential facilities to be able to, or licensees to be able to move once. And it would have to be within geographic boundaries of the current or contiguous municipality. So if I'm in Brooklyn Park, I can move all I want to in Brooklyn Park. Not all I want to. I can move once in Brooklyn Park. If I want to move to, if I want to move over to St. Paul, you wouldn't meet the qualification under this because it's not the same municipality or a contiguous one that you're sharing the same boundary with that municipality. You can move more than once in 3 years if you demonstrate that there's extenuating circumstances, and all those circumstances I'm not going to talk about today. They're outlined in other laws. You'd have to make sure that you pay this relocation fee. You would have the Department of Labor and Industry would need to approve the new location with a certificate of occupancy. And then after receiving that certificate of occupancy, Department of Health would then have 30 days to do the plan review and either grant or deny, and inspection and grant or deny within 30 calendar days. So this gives some more flexibility and mobility to the smaller providers who may not necessarily own their facility or may be renting and they need to move and relocate. And so this will be effective March 15th. Next slide. Mental illness and de-escalation training. So all assisted living facilities as of July 1st, 2025 will need to have their staff trained in mental illness and de-escalation content, in addition to the training content that you already have for dementia. The training content in the staff hours are kind of modeled off of some of the dementia training requirements. I believe it is 2 hours, should have pulled it up again in front of me, but 2 hours of annual training for your staff to annually to be able to know more about mental illness and how to de-escalate behaviors. And so this is effective. Initially it was talked about in the work group for the smaller providers, but this will be effective for all assisted living facilities. I think that there are trainings that are being put on by Provider Association and other groups. And so I think there's a lot of opportunity to receive training for this for folks and to be able to get your staff up to date prior to July 1st, 2025 with this training requirement. Next slide. And then assisted living is a protected title. This won't be in effect till January 1st, 2026. So it gives assisted living businesses some time if they need to make some name changes. Right now we have a lot of assisted living facilities that have the name home care or nursing home in their facility name. And just from a consumer protection standpoint, that can be very confusing. Just so that you know what you're receiving whenever you are going to a particular facility and want to receive healthcare services. So no person or entity is going to be able to use the term assisted living if they offer or promote itself any housing service or service package or program, unless you are licensed as an assisted living. And so if you have the name home care in your title right now, or nursing home, or something that makes it seem like you may have another service, the only two terms that were called out in the statute were home care and nursing home, you will need to make a legal name change to the name of your business before January 1st, 2026. Next slide. And I think we'll continue to move forward just in the interest of time, and then we'll go back and get to a couple of these questions I see on here. And I will let Matt take it.
All right, good afternoon. I'm Matt Heffron. I am an operations manager for the unit here at MDH that conducts complaint investigations in assisted living facilities. Next, please. Well, over this past summer, we've encountered several facilities with practices that violate the Assisted Living Bill of Rights. We understand that sometimes these practices are well intended, however, they're not appropriate to this facility type. One of the important things to keep in mind is that the Assisted Living Bill of Rights, as Minnesota Statutes 144G.91, treats an assisted living facility as the resident's home. So processes and practices need to be built around their needs and their wishes. And a facility cannot ask a resident to give up any of the rights that are protected by the Assisted Living Bill of Rights as a condition of living there, or of receiving services, or as a condition of being in a particular unit. Next, please. So for trends, some of our trends on complaint investigations that we wanted to share today are some of the examples of items that we have cited as rights violations over the last few months. One of them that gets cited under that item regarding waiving of resident rights is house rules. If you have a set of house rules for your facility that you're asking residents to sign, if that requires the resident to give up any of their right to personal autonomy or ability to come and go as they choose, or ability to select visitors or to determine their own schedule, all of those things that are protected by the Assisted Living Bill of Rights, then by asking them to sign those rules, you are asking them to give up rights that are protected by that Bill of Rights. And so if we encounter a complaint regarding those, we have been citing facilities for violation of the provision related to waiver of rights in those situations. So if you have something that's like house rules or similar type of theme that you're asking residents to sign, we encourage you to review it and make sure you're not asking residents to give up any of those rights that are protected by their Assisted Living Bill of Rights. One of the related components for that is visiting hours. We understand that visitors at unusual hours can be a burden on your facility's staff and way of managing your business. However, the Assisted Living Bill of Rights does indicate that residents have the right to receive visitors when at the times of their choice. So you need to be very cautious about establishing any type of visiting hours policy, and it's unlikely that there's any way to have set visiting hours that you could actually enforce without violating those rights that are protected by the Assisted Living Bill of Rights. We encourage you to not specify or attempt to enforce specific visiting hours because of the fact that the residents do have that protected right to receive visitors at the times of their choosing. Another item that we've seen recently is regarding bed rails policies. We know that we provided a lot of information and education related to side rails, other types of bed rails, and similar assisted devices, and the many risks that they carry. And we completely understand that many facilities wish to restrict the use of those devices because of the genuine safety risks that they pose when they're placed in the rooms of residents who aren't able to effectively use them. We do every couple of times a year see deaths related to entrapment in those devices. And again, we completely understand those concerns and your desire to care plan around them and make sure that people are not using devices that are not appropriate for them. However, it's important that you make those assessments and determinations on a case-by-case basis. The Assisted Living Bill of Rights does protect a resident's right to furnish their room. And so it isn't appropriate for you to have a policy that absolutely bans all types of bed rails in your facility or that prohibits certain types of them outright. You need to make those assessments and care planning for the individual and education to them about the risks and benefits on a situation-by-situation basis based on their needs, their mobility, and so on. Another item that we've seen some items related to rights on are threatened terminations. The statute does have processes where you can terminate a resident's housing and or services based on them not complying with the assisted living contract or creating a situation that's a danger to your staff, or for situations where their needs now exceed your capability to provide them. But it's important that you follow the process that's indicated in the statute for those terminations, where you have the pre-termination meeting, attempt to work it out with them, and provide written notice. If you tell the resident that you're going to terminate their services without following those processes, or have them sign things to that effect, or indicate in your house rules that you can terminate their services for some other reason other than what's designated in the statute, that can be a violation as well. The same thing is also true with items such as alcohol in residents' rooms. Again, we understand there are situations where you may be able to have a policy about alcohol and consuming alcoholic beverages in common areas of the facilities, or you may have some very specific needs and risks associated with particular residents. However, it's unlikely that you can have a policy that says that you prohibit alcohol in your building entirely or on your campus entirely, as it is a legal substance for adults of age to use. It's often within the residents' rights to autonomy and right to make their own choices about their living schedule, to decide whether to have that in their own rooms or to use in moderation themselves. And so it's unlikely that there's any compliant way for you to have a situation where there is where you would prohibit alcohol entirely on your campus or your building. And I see there's some questions in the chat about the visitors. Can you use suggested visiting hours? Absolutely, that's a possibility. Again, if you attempt to enforce it, you may be violating residents' Bill of Rights. But if you are just providing communications to families about better opportunities when they can visit, that's fine. Are there statutes about how long a visitor can stay with the resident? No, there's not a specific timeline. We do get the question occasionally about how long a visitor can stay. You certainly can and probably should allow visitors to stay over a night or two as a part of respecting the residents' right to have visitors and to have their own autonomy. However, if it is so frequent or for such extended period of time that that it would now be fair to say you are housing that individual, that they live there now, you don't have to permit that. It's whatever is reasonable under the circumstances to be considered visiting. You certainly can permit, and we encourage you to do so up to a certain extent. But when it gets to the point that the person is living there, that's a different situation. And of course, if you're truly having the person live there, they are a resident. They count against your capacity, and you would need to have an assisted living contract with them. So, again, there's no hard rule about 48 hours or 2 weeks or anything like that. It depends on the totality of the circumstances when that line is crossed from being a visitor to the person really residing there. Someone mentioned about termination due to non-payment. Again, termination due to non-payment is permitted by the statute for termination of housing and services. Just make sure you follow the process there for the proper notification on those. Some of the ones where we would say it's a violation of the resident's Bill of Rights are situations where the resident was terminated for making requests that were reasonable. We had a resident who was terminated for calling and reporting instances to us. Those are not appropriate reasons to terminate someone's housing and services. And if you couldn't actually discharge them for doing it, you shouldn't threaten to do so. Next, please. Finally, one of the items related to rights issues that we've seen a lot of cases on over the last few months are rights issues specifically in relation to secured units. The purpose of secured units in assisted living is to provide dementia care. That's in the definition of secured units in the assisted living law. And so when residents do not have an individual need for a secured unit are in that secured unit, it creates a number of complications. One of those is that the resident who does not have that personal need for a secured unit still has the right to come and go as they choose, and you have to have a way built in to their care plan for them to be able to exercise that right safely. At the same time, the facility is still responsible for the security of the unit, so that resident needs to be able to come and go as they choose, but without letting out a resident who may have a wandering behavior and not be safe to be outside the secured unit. So it's important that those items be balanced when you have a situation where someone may be in a secured unit who doesn't personally have the need to be there. Some of the items that we see in relation to that are, one, it's important that the person's individual abuse prevention plan document the measures that are in place regarding the individual being there, how you're keeping both them and other residents safe from each other with them being in that environment that they don't personally need. Second, that the care plan or service plan, or however you document the interventions that you're choosing, indicate how you are ensuring that that resident's right to come and go is respected, and also that at the same time it's covering the fact that you need to provide that secure unit to the other individuals who may be there who do need it. Balancing those is extremely important, and it's very complicated to do. There are the majority of circumstances that we've seen recently where individuals are on a secured unit without personally needing that service do end up being non-compliant for one reason or another. So it's important to carefully evaluate that situation if you have that there. Those are the main things I have today regarding the complaint trends. A couple of items I wanted to call out on the chat as they went through. Someone asked, can you have a policy requesting alcohol orders from the primary care provider if the person is using the alcohol in the building? I haven't seen that particular scenario come up, but I would say that if the individual is cognitively intact and able to make their choice for themselves, we wouldn't expect or require that there be a provider's order indicating that they are or are not able to. Again, the assumptions that the assisted living bill of rights starts with is that this is the resident's own home and they're able to make that choice for themselves. If you are requiring an order or you believe that the person is not appropriate to use it, it's important that you document why they can't, because the default would be that they can. On the question, someone asked about smoking marijuana. I know we have given guidance that generally speaking, use of cannabis products in Minnesota should be considered similar to your policies for use of alcohol. However, we do understand you are allowed to declare your area a smoke-free campus, and so you do not have to permit smoking of marijuana on your grounds if you do not permit smoking of tobacco products on your property. Someone asked if the resident has visitors that are causing safety issues for others or the environment to be unsafe. Another person asked if guests are disturbing others, and there was a question somewhere along the lines about whether particular visitors can be prohibited. The answer to all of that is yes. If the resident's right to receive visitors does have some caveats on it. And if the individual has created a situation that is not safe for the residents, other residents, or your staff, individual people can be prohibited from visiting the resident. If it's a situation where the person has a guardian or their healthcare decision maker, it's of course important to involve them. If it's a situation where the person has caused a disturbance on your premises, it may be important to involve law enforcement and or your own attorney. And use tools such as a written trespass notice or things like that as necessary to keep people safe. Again, if the person is causing disturbance or has endangered your residents or your staff, you certainly can take measures to plan around that and restrict it. What we're more concerned about on the rights violation side of things is just if you have an across-the-board limitation of no visitors after 6 p.m., 8 p.m., those are some things we've seen recently that are clear violations. The resident receiving visitors at normal, reasonable times into the evening is something, when the visitors are not causing a disruption, is something that you have to permit. But yes, if the resident is causing disruption, there are tools at your disposal to work around that. Yeah, so that does include the safety of your staff. If an individual, for instance, has threatened staff members or something along those lines, the normal tools that you would have for excluding someone. Again, you might want to get legal advice on your particular circumstance, or let us know about what your specific circumstances are, but if a visitor has actually endangered your staff, you do have tools available to exclude that particular person. All right, that is all I have. We will look at some of the other questions that have been submitted today, but thank you for your time today.
You can hear me now?
Yes.
Yes.
Oh, I have no idea why I did nothing new and different except, okay. All right, so let's go forward. Assisted Living Survey update. We can go to the next slide. All right, so MD just close to the finish line on the first round of assisted living surveys. We are only about 6 weeks away from completing the first round. Yes, it was August 1st, 2021 when the licensure was effective. It took us about 6 months to get more of the staffing that we needed to be able to complete the survey process. So we didn't start as timely as we would like to, but the exciting part is that really for the first time in Minnesota history, every licensed assisted living facility by the end of September will have been surveyed in the state of Minnesota. So I think that is a big win for public protection for our seniors, and that every provider will have had a survey that has not happened before. And that is certainly, I think, something that's exciting. We are working on plans now, even for the second round of surveys, and doing projections to get back on that 2-year cycle that we are statutorily required to be on and we want to be on, and so that you can have clear expectations of when your survey will be coming. So if you have not been surveyed yet, big hint, it will be any day now, as we are finishing up with the first round. I think we probably have a little over 100 facilities left to complete, and then every facility will have had their first survey. Go to the next slide. So as I said, we are already focusing on the next survey cycle. I would anticipate late October, early November, us beginning the second cycle. We're going to be working on, if you have a provisional license, we are working on getting more provisional licensing surveys completed, as well as plan reviews. And so catching up on those numbers as well. And we're trying to focus on making sure that folks get their provisional licensing survey that is due within 12 months, which is the length of the license, as well as trying to get there's no statutory requirement for a plan review if you're a provisional licensee and you've been in that plan review process. But we really want to make our timelines as quick and as efficient as we can. And so we are working on catching up on those plan reviews as new licenses come in. And so please expect that the next cycle will be starting in the fall, and we'll be getting to you soon if you have a provisional or plan review submitted to us. All right, next slide. If you were on the call last quarter, back in May, you're going to notice a lot of the same correction orders that we talked to you about then. Here I'm showing you the last fiscal, the fourth quarter of 2024 fiscal year with the state, which is really April through June data. We like to give a little bit of lag time in our data because we do have 30 days once we've been to your facility to be able to get correction orders out to you. And so we want to make sure that we have enough time in between giving you any data so that you can get the most complete information that we have. Food code tends to be, and has historically been, number one, most cited, because we have one tag for food code, whether it's priority 1, priority 2, or priority 3 that the facility's been cited for. And so that all goes under this single minimum requirements code. Most of these are the same that we would have shown you last time. Second place continues to be fire safety and evacuation plans, which I think Bob is going to talk about in a few moments here. Disaster planning, emergency preparedness, having those plans in place and have implemented any training necessary for your staff, having continuous state of good repair, just making sure that, there's no holes in the walls or in the ceiling or broken glass or tiles in disrepair. And of course, running a facility, there are going to be things that are in need of maintenance, but if you, one of the things that our engineering staff would be looking for, like, have you mitigated that issue if you've noticed that there's a maintenance problem, such as, that you've identified it and you have a plan for it. Smoke alarms still tend to get cited often. I would say most of the April through June surveys were largely the smaller providers in the residential homes. And so smoke alarms, not having them on all levels and being interconnected, so that they will alarm, if one alarms in one area of the house, it alarms in all areas of the house, continues to be an issue. TB, it's always on there, always has been, pretty much. And so that tuberculosis prevention and control, reviews, assessments, monitoring, often having assessments completed timely according to the statutory timelines, or not having an assessment after there's been a change in condition of a resident has been cited. Fire extinguishers is something that we've noticed in the smaller homes, either not having them available, not having them in working order, or they've expired. So making sure that you're checking on your fire extinguishers. Staffing plan continues to be often cited. That's number 9. Not having adequate staffing. I would say often what we're finding now when we're writing for staffing is that you have someone that has needs, whether they're planned needs or unplanned needs is what the statute requires, and that you have adequate staffing for that. So if you have a person that really is an assist of 2, and you're only staffing one person on overnight, that's going to get a citation. And I know often providers will say, well, we put the person to bed at 10, the second person goes home, they stay in bed all night till 6 o'clock in the morning, 7 o'clock in the morning, and so we don't need that second person. But you do have to plan and schedule, but that person's still an assist of 2. So you have to plan and schedule for any unanticipated needs, where if this person does have to get up in the middle of the night for an unanticipated reason, they need to go to the bathroom, maybe they're experiencing pain, they need to be moved. And so we're often finding that those folks that need a certain level of assistance, there's not adequate staffing to meet that need 24 hours a day, 7 days a week. And that's often why providers are getting cited. Egress windows. I would say we orders for egress windows. Bob's going to talk about this as well. Anywhere from 6 to 9 times in a week. This is something that we're anticipating once we get through this first survey cycle will not be an issue, because as new licensees are licensed, this would be caught on a plan review if there was an issue with egress window. But right now we still are surveying conversion licensees, and often finding these with folks in the small residential homes with older construction, that the egress is just not the appropriate size, and Bob will talk about that. But here's where the top 10's been for the past quarter. Nothing really different or a large change in any of the trends that we've been seeing. I anticipate when we come up to our second round of surveys, we'll start seeing some changes in trends, because we'll start we'll have been through some of these issues like egress windows that we wouldn't anticipate seeing again. And then hopefully folks that were surveyed back in 21, 22, you'll have learned a lot, experienced a lot since then, and have more of these environmental pieces and these fire protection plans up to date. And should be some shifting of what we'll see in future pieces of survey data. All right. So I'm going to have you move forward here with the slide. And I think now we'll go to Bob.
Well, good afternoon, everyone. My name is Bob Daler. I am the engineering manager here at the Department of Health. And of course, in engineering, we do the plan reviews, the inspections, and now the surveys for assisted living. And so this afternoon, I'm going to be talking briefly kind of about the big things that we're seeing nowadays, and then also kind of a little bit of the news that you may or may not be excited about. I certainly am, but I guess we'll get to that here in a little bit. Next slide. So with the windows, this is something that that we see a lot right now because we're kind of, we're finishing up on the surveys. A lot of them are in these smaller buildings like the single family homes. And this is something that we see quite a bit right now. And if you're happening to be listening and you have a single family home and you haven't been surveyed yet, please measure your windows. We actually have had a recent survey where we went to go do the survey, and right away they told us that they measured the windows and the windows did not meet the correct size, and therefore they decided to enter into a fire watch to basically keep them from getting an immediate citation from engineering, and that did, and it helped them. So they were able to be proactive and measure the windows and get ahead of the problem. Essentially, what the issue with the windows is when you open your window. So let's say you got a basement bedroom, or actually any bedrooms in a single family house. Let's say any of those bedrooms, there has to be a window, what they call an egress window, which has to be a certain size. 648 square inches of open area is what the fire code is looking for. But it also can't be anything less than 20 inches in either height or 20 inches in openable width. So it couldn't be 10 inches tall, but 6 feet long, in other words, or vice versa. So again, when we measure the windows, we measure the open space, so you can crawl through. It's not only so you can crawl out, but it's also so, let's say a firefighter could crawl in with all of their turnout gear and help people. But what we see when we cite these, there's really kind of two routes that people take. If they have extra bedrooms that they don't have capacity for, they'll move residents from a bedroom that may not have a correct window to another bedroom that does, that's not occupied. Or what they'll do that we've accepted in the past is to do a fire watch. So essentially that's somebody on staff that is walking through the building and around the building every half hour, basically looking for smoke or fire, and trained to help evacuate, especially especially to make up for the fact that the windows aren't sized properly. So their first priority essentially would be to help those residents that are in the rooms with an incorrectly sized windows. So that's the thing with the windows. It's a tough thing, and I know it. Hopefully now that after we get through all these surveys, we're getting ahead of them now. This is one of those things that we didn't anticipate, but we came across it, and it was just something, especially in the outstate areas where there isn't really a fire official, that it wasn't getting looked at, and this is something that's dangerous enough where we couldn't just let it go. So again, if you haven't been surveyed and you're listening, please measure the windows, and if you've got all your rooms occupied, enter into a fire watch, so when we do come in and survey, you don't get immediate correction. There's no fines and all that kind of good stuff. Next slide, please. Fire safety and evacuation plans. This is one of those the tags that we issue a lot, and this isn't just reserved to the smaller facilities. This we find really on all the facility sizes, let's say. But it's fairly simple. You have to develop a plan, and you have to make that plan available. You have to train your staff. You have to train your residents, and then you have to execute your drills. You have to do the evacuation drills, or what we also call fire drills, and then test that plan. And quite frankly, I hope when you do your fire drills, you find things that don't work. You find out that hey, Bob really didn't pay attention this time, or he didn't understand what he needed to do. Maybe we need to talk to him more and train him on this, or nobody understood this part. So the more you when you do your drills, really looking back and trying to learn from those drills and see what could you have done better, and then you change that plan. And then you go through the testing and the training and the drills and test it again. So I will say that we do get some questions about, well, what kind of training are we supposed to give staff? What about how do we train our residents? They don't want to be trained, or what exactly are we supposed to tell them? What we found that I would say are probably the most successful trainings, and this really goes to staff and residents. But we've seen people use like two different scenarios. Let's say a scenario where there's a fire in the hallway. If there's a fire in the hallway, or a fire in the even in like a resident room. So scenario one would be a fire in a hallway, or in a dining room, or what have you, or in a resident room. What if a resident's in his room and they notice smoke, or they notice fire, or whatever? What are they supposed to do? Are they supposed to come and tell staff? Are they supposed to call 911? Are they supposed to get a fire extinguisher? Hopefully not. What are they supposed to do? And are you training the residents to, like, hey, if you see smoke, if you see this, do this. What are they supposed to do? What do you expect them to do? Do you expect them to go out of the building? Is there a thing called a smoke barrier in your building? Are you a large building that has smoke compartments that you can go to another area? Do they know those areas? Same thing with staff. If there is a fire in a dining space, what's staff supposed to do? Who's supposed to call 911? Who's supposed to hit the fire alarm? Pull the fire alarm. Who's supposed to meet possibly the firefighters at the front door? Have you gone through your plans with your local fire departments? Are they familiar with your building? You could be a large building, you could be small. Do they know who you are? Do they know who your residents are? It's always good to get them involved as well. But when you talk about these plans, we talk about what are staff supposed to do, and what are your residents supposed to do? When you're a larger facility, you're going to depend on your residents to do some things. Generally speaking, the staff are in charge of this process. The staff really need to know what to do and when to do it. And it's good to be very, very definitive in the plan, very descriptive in the plan. But the key thing too is that it's available. So a staff person, and maybe there's a specific person that would grab it, the ones that's kind of directing what's going on. They can grab that plan and make sure they're having the right people do the right things. But that fire safety and evacuation plan, I would say go to the statute 144G.45 subdivision 2 B through F and read that. And those are the exact same questions that we ask on survey. If you have those questions answered, and if you think about a couple scenarios, like a resident room, or outside in a hallway or in a dining space, I think you would be fine if you had plans based on that. Next slide. Plan review and inspection. We get a lot of questions about this. Essentially, if you're doing any work in your assisted living, it would require a plan review and a permit from the Department of Labor and Industry. So if you're doing any planned work, Department of Labor and Industry will have to review those plans, and Minnesota Department of Health. Department of Labor and Industry, they're going to look at the Minnesota State building codes. They're going to look at the building code, the fire code, the electric code, the fuel gas code, all the different Minnesota State building codes. MDH Engineering will also review to our codes, probably Life Safety Code and FGI, or at least the 144G. And just remember too, when you work with us, when you work with MDH, we will do a plan review, but then we also do an inspection. So we want to review the plans, but also when construction is complete, engineering needs to go out and inspect that to make sure that the work that was complete at least meets the code. Sometimes things change and what gets constructed may be a little bit different that's on the plan, but ultimately whatever is built has to meet our codes. And I know sometimes people think, and it is a little bit of a pain in the neck to have us review those plans. But in reviewing those plans, we're really helping you be compliant up front. So if we can find stuff on paper, it's a lot easier to fix the paper than it is to fix it after construction. So our whole goal is to find things early and to help you out up front versus finding it on the back end. But remember, if you got some work going on, you'll have to submit to Department of Labor and Industry and Minnesota Department of Health. And by the way, if you're in the metro area, or if you're, big city, Department of Labor and Industry, they have what they call delegation agreements with other cities. So sometimes there's a delegation agreement with a city, but you can always call Department of Labor and Industry, and they'll let you know if they have that delegation agreement or not. When that stuff goes through, I'd leave that with your architect or your engineer to figure out who needs to get those plans, or who needs to get those submittals. So, next slide, please. Locking. We kind of talked about locking a little bit. So there's locking in licensure that's tied to our dementia care license, and then also in building and the fire codes. Essentially, in assisted living, you can't lock the means of egress. You can't keep people from leaving the facility. That is a violation. If you have a assisted living with dementia care, you can lock that for the protection of the residents. But there's some very specific requirements. And when you look at the building and the fire codes and even the life safety code, there are specific things that you have to do. There's some interconnectedness. You have to have a sprinkler system and a fire alarm system that's tied to it, so the locks will unlock. So you got to make sure that you're meeting the building and the fire codes as well as the life safety code if you're locking doors. But just remember that licensure says that if you lock a door, people are what we call incapable of self-preservation, and therefore they would have to get that assisted living with dementia license. Next slide. This is my good news. We got new staff. We actually just onboarded 4 new engineers with fire and building code background. They're getting trained probably as we speak. So it's really nice being able to kind of staff up and be able to get out there and actually perform the surveys that we need to support the teams. We've historically kind of been lagging behind when it comes to staff. So once we get the new staff coming up, we have one more person to hire in the next couple months. We'll get that advertised, hopefully in the next couple months, and get that person onboarded, and then we should be doing quite well. We are about about 14 or so weeks out on plan reviews right now with the new staff, and finishing up this round of surveys. This first round, we're hoping to put a lot of effort into those plan reviews, get caught up with that a little bit better, so we're not that far behind. We hate being that far behind, so we will be focusing on that pretty strong, especially with the new staff that we have. I think that's it. Next slide. Ooh, I don't know what's next.
Can you hear me?
Yes.
Okay, just before I start talking. All right, everybody, I know we're running over time. Gia, if you could go to the next slide, just to give you a couple of announcements of what is coming up. National Assisted Living Week. Hopefully you are aware that it will be National Assisted Living Week the week of September 9th. So that's just something to celebrate what we do, or what you do, I should say, in assisted living. There will be another WebEx that we are preparing for regarding opioid overdose in healthcare facilities. We have had some complaint investigations here related to overdose, particularly with in assisted living facilities, and we will be collaborating with our overdose prevention unit here at the Minnesota Department of Health, bringing you some information regarding what we're seeing here through our complaint investigations here at MDH, as well as resources available to you regarding this topic on September 12th at 1 p.m. So look for that to come via Gov delivery email for more information. And then our next assisted living quarterly update will be in a quarter. It'll be November 18th at 1 p.m. And we'll give you similar updates. If you have suggestions for topics, things you would like to know more about, feel free to put them in the chat or email our general email box. We know of some more things that we would like to create some education for you all on, but always looking for suggestions. You can go to the next slide, please. And here is the general email box. If you have any questions regarding anything, honestly, regarding assisted living, you can always email this, and this is checked Monday through Friday. I also put in, if you had questions specific to engineering or your specific plan review, inspection, etc., there is an MDH Healthcare Engineers email box that you can email as well, and I put that in answer to one of the questions in the chat. We thank you for your participation today. I'm glad that we are able to hold these and connect with providers more and help to answer some of your questions. Again, please reach out to us if you have questions regarding a specific situation at your facility, and we will see you again soon. Thank you.